Now I like to request Pamela Hopwood for her presentation. Pam is a PhD candidate, School of Public Health Science, University of Waterloo.
Thank you so much, and it's a pleasure to be here. As Tauhid said, I am a PhD student at the University of Waterloo, and I am supervised by Dr. Ellen McEachern. Today, I'm going to talk about my PhD research, which focuses on gig care workers, and specifically unregulated care workers, which means these workers are not like nurses or physicians or dentists, for example. They don't have any professional regulation. So among these unregulated care workers are personal support workers in Ontario. They're also called healthcare aides or home support workers in different areas of Canada. But these are among a very vulnerable workforce that has work conditions that are known to be of risk. And that includes elevated levels of violence, very high prevalence of injury, illness. Oftentimes their jobs are part-time and many times 0-hour contracts, meaning that they're not even guaranteed a minimum set of hours. And many of these workers have multiple jobs as well. As I mentioned, they are unregulated workers, but they also lack organization in that they're less likely to be unionized than other professions that are more regulated and organized. So looking at the employee workforce that is in the unregulated care worker grouping, they fall under the Workplace Safety Insurance Board classification of assisting occupations in support of health services. Now, among employees, this group makes up 2% of the covered WSIB workforce, and yet they have 14% of the injuries and illness of the entire workforce. So we can see from what we know about employees in this area of work that it is a higher risk occupation with greater levels of illness and injury. And so you can understand why I'm interested and concerned about the work conditions for those who are gig workers or self-employed. A little bit more about the employment context. As I mentioned, we do know some things about the employee workforce, and that is primarily those who are employed in hospitals, long-term care homes, and in home care. And those are all publicly funded healthcare positions as part of our formal healthcare system. However, when it comes to the self-employed unregulated care worker, less is known. And when it comes to unregulated care workers who are self-employed or gig workers and also use apps or digital platforms to try to find their work, almost nothing is known. So I'll be talking about my PhD research, which asks the research question, what are the experiences of self-employed personal care workers who use digital platforms to try to find jobs? So for my research, I conducted 20 interviews with gig or I'll use digital platform or app interchangeably. And they all used apps to find work in the context of Ontario. And after completing my interviews, I was able to determine that there were two types of apps in use. Marketplace apps, which were used by workers to find work in private homes for individual clients, and then on-demand platforms. And these were used in hospitals and long-term care publicly funded institutions to find, the workers used these to find shifts in hospitals, long-term care homes, for example. So with these workers, I conducted interviews of averaging 48 minutes, and these were audio recorded, transcribed, and coded, particularly looking for their experiences of using the apps. I used institutional ethnography as a method of looking at some of the ways that the workers experienced the app use. And I really wanted to focus on the technology as opposed to the work conditions while providing care, in order to consider what some of the elements of technology are and how that shapes work conditions. So just a brief note on my methods. I had difficulty finding workers. This is a very diverse and also geographically distributed workforce. They work either in private homes or on casual basis in hospitals or long-term care. There's no gathering place. As I said, there's no formal association that everybody belongs to because there's no regulation. And so finding participants was a challenge. And in order to find enough workers to participate, I ended up going on on digital platform apps and posing as a customer who wanted to hire a caregiver for myself. Now, when I did this, I used a pseudonym, and then once I was in contact with the worker, I revealed who I was and asked them if they would like to participate. So 8 of my 20 workers, or 8 of the 12 marketplace workers, were recruited in this manner. Of my sample, 45%, or 9 of the 20 workers, were Canadian-born. So it was disproportionately an immigrant workforce. On the marketplace apps, which is this portion of the sample here, 12 workers, I'd just like to draw your attention to the column on the right. And this shows the experience, or the number of jobs that workers were able to find on these platforms. Several of them paid a membership fee to belong to these platforms, and that could be from $20 to $40 a month. How many jobs did they find? 3 of them had never found any job. Only 2 had been able to find more than 5 jobs, and the rest found between 1 and 5. So the key themes in my findings were that as self-employed workers, they did not have workers' compensation. Also, they had no payroll deductions because they were paid via a digital platform app or by a personal client. And with that, they also didn't make contributions to Canada Pension. They had very low and variable opportunity. There was no consistency in job offers. And there was risk involved, especially for workers going to private homes. So as I mentioned, paying to be able to use these platforms was one of the topics that came up. And workers found that they couldn't even send messages to others. So there was some digital gatekeeping by the platforms in this way that really restricted what a worker could do in terms of contacting potential clients. Another issue was a lack of communication, and this stems from some of that digital control. And the membership, which of course was paid, enabled people to contact, not only send more messages, but to contact more people. And that worked from both sides. So even as a client, I found I couldn't send messages to workers until I paid a membership. And I did that with a Visa gift card to keep it anonymous. One of the concerns that workers had was not having information about their potential clients. And as opposed to an employee who would be going to provide care in a home, their employer would go into the home and do an assessment first, and they'd also have verified information on who the individual was and where the worker was going. In these cases, workers were going to a stranger's home to provide intimate care without having any idea what they were walking into. Another topic that is, although was seen by this worker as an advantage, actually presents some risk for workers, and that's the issue of liability. As unregulated care workers, they don't have a defined scope of practice. So they're able in home care as privately employed or self-employed workers to perform any task that's requested of them. If they were an employee, there are a more strict set of regulations around what they can do, and that's carefully monitored by the employer. So you would not be allowed to give insulin, medication, cut toenails, so forth. However, Joyce, in this example, saw that being able to do those things because she was self-employed was an advantage that let her charge more money. Now, if a worker has liability insurance as a self-employed worker, that would help protect them, obviously, but this certainly wasn't something that the apps recommended. There was also a risk of no one knowing where they were going. And Keisha really hit this point home for me in what she said. She always would let somebody know where she was going, and she would even record a video saying, "I'm here, I'm safe, and just in case, this is where I am, my last known location." So among the occupational health conditions for these workers, there was risks involved with sharing their own personal information so that clients could get in touch and hire them, meeting strangers. They faced a lack of opportunities, even though they were sometimes paying memberships, and potentially there was extra liability, especially if they didn't have insurance. So this introduces personal and professional risk for these workers. And this is just a brief comparison between on-demand and marketplace workers and conditions. And the marketplace, which were used in hospital and long-term care, were much different conditions in that there were slightly more opportunities, but there was a lot of pressure. And for the marketplace workers, the primary issue was a lack of opportunity. So overall, this demonstrates a move away from formal employment and these informal working conditions that clearly hold some risk and liability for the workers, but also for the clients receiving the care. And so, as I mentioned at the start, given the workplace rate of illness and injury for employees, you can understand why as gig workers, it's a concern for these self-employed workers to face the same conditions and even more so be in vulnerable positions. So there are many things that we can't see about the digital aspects of the way that the digital platforms work in how it functions and some of the technology controls that it has. And so in conclusion, these digital platforms function in a way that is not transparent to the users. There are things that they're not able to see or understand about how the technology impacts what they're able to do. And further study of this population is important to consider. I'd just like to thank my supervisor for her rigorous training in this and guidance in my projects going on. And I'd also like to acknowledge that I was supported in part by Canadian Graduate Scholarship from the Social Sciences and Humanities Research Council. Thank you.